You are listening to a conversation hosted by Aspen Digital, a policy program of the Aspen Institute, in collaboration with the SCAN Foundation. The Older Adults in Digital Equity work brought together a group of leaders from across tech, civil society, academia, and public policy for a virtual roundtable discussion on how older adults should be represented at every stage of the innovation design cycle. To help center the overall conversation, the convening kicked off with the following fireside chat between Annika Hevener, the Vice President of Investments and Innovation at the SCAN Foundation, and Kara Carter, Senior Vice President of Strategy, Programs, and Staff at California Healthcare Foundation. You can hear their conversation shortly, and to read the playbook that was produced as a result, please visit our website.
Okay, so let's dive in. So we're here to talk about older adults and technology, which I'm honestly excited to learn about as much as I am to talk about. And I will say, I think for most people, myself included, older adults aren't necessarily the first segment that we think about when we think about tech innovation. From the SCAN Foundation and from your perch, tell me a little bit about this demographic and why the tech industry should be thinking about the population.
Yeah, first and foremost, I think a lot of us on the call are aware of the broader trends, the aging baby boomers, but both globally and in the US, but also the magnitude of this. I think sometimes the numbers we're not aware of. And like for older adults, 65 plus in America, this is projected to increase from million in 2022 to 82 million by 2050. And so that's a huge in terms of a demographic shift and all that entails, from purchasing power to how they will contribute and participate in society. But that also, as we think about the tooling that we will use to live our lives, it's the demographic that those tools, like AI, automation, advanced analytics, whether that's showing up in healthcare or the way we live our life, it has to serve this aging population. Noting also that this is a population that has seen different seasons of technology evolution. The older adult population definitely lived in a world where they were still writing with pen and paper. And for some of us on the call, we still had to learn cursive in elementary school. And so recognizing that they are not the quote unquote digital natives doesn't mean that there's not digital literacy, but they have a different generational story around how they have utilized technology. We see an incredible market opportunity, but also a different way of approaching technology that definitely should be looked at from a consumer perspective, but also current for both you and I, our organization focus on healthcare. And so from a patient perspective as well. And so hopefully, Cara, sure this sort of, in terms of as we think about the dynamic of tech being built for older adults, especially in healthcare, whether that's medication management or care coordination, social connectivity, there's a lot behind the scenes of health tech, and much of it has the stars and the special effects right now of being AI enabled and that impacting the lives of older adults. You and your team just had an incredible webinar on AI, good or bad for health equity. Coming out of that conversation, can you give us a quick snapshot of one, why you felt the need to have that conversation, but what were some of your key takeaways?
Sure, happy to do that. It's funny. Why we felt the need to have that conversation, I almost feel like, does it need to be said? I don't know. One of the great privileges of my job is that I spend a lot of time traveling around California, getting to meet with leaders in the healthcare space. So people who lead plans, people who lead providers, people who work in digital health tech, people who work in state government and our policy leaders. And there is not a single conversation over the last year, no matter what was on the agenda or what the topic of the conversation was meant to be, that didn't end up in AI. And it is clear. So everybody is talking about it. It is, as someone who is rapidly becoming an older adult, a solid Gen Xer here, my whole life has been looking at like, where is this? When I was little, we were going to be the Jetsons at this point, right? We're not the Jetsons, but this is the technology that really has the potential to have that kind of impact on all of us. And so everybody is talking about it and trying to figure out what it means. And at the same time, there can be a pretty big disconnect between folks who are building technology, folks who are deep in technology, and folks who are making policy and regulatory environment that will either enable that technology to thrive or create barriers. So we see our space in the world as really trying to bring those worlds together, trying to educate policymakers and trying to create a space where we can have an open and honest dialogue about where we are. In terms of where do I land on the answer? I was a management consultant for a really long time before I did this job. So I'm going to give you the unsatisfactory management consulting, it depends answer. largely I would put myself in the cautiously optimistic bucket. There is so much good that this technology can do in healthcare. I think that is both hard to quantify and undeniable. Everything from, if you look across the whole value chain of healthcare, you start at back office. There is no health system or plan that is not already putting AI enabled technology into place, whether that's in note taking or coding or revenue cycle management or patient segmentation or marketing. And then we're hearing a lot about the use cases that are shinier than that, right? The ones that people get really excited about, but also scarier, right? In clinical diagnostics and new treatments and new patient triage. All of that is happening. And there's the potential to do good is enormous, an incalculable potential to have positive impact on our patient populations. When you talk about older adults, I asked my first question thinking about older adults as end users, but older adults are also the recipients of care and involved in the ecosystem in many ways. And I think you have to acknowledge that we're not there yet. Like the great promised future, we're not there yet. We're still on a path. There are two big cautionary points for me. One, it sounds really obvious, but this technology needs to work and it needs to work reliably. And we are not there yet. We just aren't. Yes, AI can do better than a primary care physician at making patient diagnostics some of the time, but not all of the time. And so that is just technology still in development. And the other is we have to be really thoughtful. Everybody has seen over the last few years, not in generative AI and old AI, big problems with embedding historic inequities into data sets that drive future inequities. And so as we get into this next generation of technology, we have to be, I think, very careful and very thoughtful about making sure that we're not doing that. Healthcare, there are many things. You think of the use cases that we all have, right? I use my Gen AI buddy to help write my tweets, right? But healthcare is not a tweet. It's really complicated. So I guess I put myself in the optimistic bucket, but the cautiously optimistic bucket. And it's less to me about the technology and more about what we do with it. I want to turn back to you. Does that resonate with you? Are there other kind of particular considerations that you have when you think about this question about whether it's good or bad, particularly for older adults?
Yeah. Also, as a former strategy management consultant, I'm gonna evade the question a little bit and flip it and say, I don't know, that's actually even the right question we should be questioning. In saying that, I think we need to be problem focused. We need to continue to go back to what are the biggest problems in healthcare and how are the tools in our expanded toolbox now, including AI, solving those problems. I think one of the things that I'm mindful of is AI for AI's sake, or it seems like everything is having an AI element these days. And that is one, diminishing, frankly, the real force power of AI and really having it transform healthcare in the areas where it truly has a immediate effect for large language models, Gen AI, to really be coming to bear in the way we can think about improving patient care and doing some of the four things that we always come back to when we run any program within healthcare. What is the clinical impact? What is the financial impact? What's the impact to the patient experience and also the clinician experience? And so I want to continue to challenge whether it's the EHR or digital health or now AI, what is the problem it's solving? Because what I'm concerned about is that we're going to spend a lot of time, money, energy on areas that, frankly, maybe our current way of working is sufficient. And so how do we make sure that AI is fit for purpose is one of the biggest questions I think we need to be asking ourselves. But to the question around AI, good or bad, and health equity, I think there's a critical thing to dig into here because health equity is a persistent issue within care delivery. Full stop, non-negotiable. We see it show up in the way patients are prioritized, but also their bias within clinical guidelines. And recognizing that this new tool coming into the toolbox has the opportunity to minimize those inequities or deepen them is one of the things that I think we really need to be mindful of developing. What I am mindful of with when it comes to health equity and how we can, the standards I think we need to uphold are one, ensuring transparency. And I think this is outside of healthcare. It is not just a healthcare specific aspect of the standards of transparency around how these models, how these LLMs are created and who is the developer, what country, the data set that it's trained on. How do we ensure that we are understanding the nutrition label of development? Then what the context that it's going into, we have to make sure that these solutions are contextually relevant. And that's one of the things I see as really promising developments for Gen AI is getting the cultural context into course. But then there's also a massive piece around management and monitoring. I have some conversations with some of the bigger tech players today, and it feels like the last 5 minutes, they're going to do that bias check. That last 5 minutes, they're going to check and do that red teaming. It can't be the last stop on the journey. It's got to be throughout, again, in representation and the way we build that model and the way we then do the monitoring and governance. So I see a real process of evolution about the way we think about health equity in the context of AI. Because otherwise, I do see it as a big risk to further the haves and the have-nots, understanding the representation of marginalized populations in these data sets is going to be vital. Again, not just in healthcare. I consider the fact that like the internet has been consumed, right? The models that we are looking at, and whether by the time we're done with this conversation, ChatGPT-5 will be out and working their way there. It's moving so fast. And so recognizing that one of the new areas for pursuit is new data and representative data. I see an incredible opportunity for us in the health equity journey to make sure that we are bringing new data that is representative of marginalized populations to the table, and that can really be a model differentiator. Yes, I see a lot of potential around health, good or bad for health equity, but also a lot of watch outs for us to consider in healthcare.
Yeah,
No,
before
go
we
ahead.
move on, one thing that neither of us mentioned that I just wanted to put a pin on health equity. I spend a lot of time talking about exactly the topics that you're talking about, how we make sure that we have representative data, how we make sure that we are tailoring our solutions to meet the needs of the populations that have the biggest needs.
Yep.
And I also sit with like this tension between when I work with safety net institutions, this tension between pushing back on technology like this and recognizing that the technology is happening. And if we don't spend time and attention to make sure that we have the ability for safety net institutions to adopt it and to deploy it, we will end up in a position where the wealthy white communities have access to the upside and the communities that I care about do not. And so
100%.
we also have to,
So glad you're underscoring that, because regardless of healthcare or any industry hype cycles, right? We know that innovation goes to the haves versus the have-nots first. Those who are well-resourced with financing, talent, networks. And so I think this is one of the biggest challenges we need to pose to AI is it is exponential in its productivity, exponential in its throughput. How about exponentially accessible in serving marginalized populations and accessibly affordable for a safety net hospital who it has the minimum margin? And I learned this the other day that the average IT budget across all hospitals in America, $7 million. Well, shoot, they're not going to be able to afford some of the bright, shiny new things or
Right.
that and the cost of Gen AI today and some of the emerging models and best practices. Again, upholding governance, monitoring, quality, it's not cheap. And so recognizing that we, for scale to reach marginalized communities, there's also a cost factor. And so
Okay.
how do we incentivize the big players that are developing these tools to think about equitable distribution and democratizing these tools now? Right? Because that's the promise, right? That it can reach more for less. And so we really want to hold them accountable, I think, too, here, Cara.
Yeah, I completely agree.
Awesome. Noting that you and I both live and breathe healthcare, are there lessons to be learned around inclusive and equitable AI that we can pull from other verticals?
Yeah, I think there are. I do live and breathe healthcare. And I would say in some ways, healthcare is like a great litmus test because it is so complicated.
Right.
So it is so complicated and more complicated than many other industries. So if you look at the things or the barriers or the ways that healthcare is trying to adapt to technology, I think there's a lot of things that other industries can learn and grab on. The first that I would go to, we do a policy poll every year of Californians, and we knew from this year, it just came out how mixed Californians' attitudes are towards AI in healthcare. It's less than 50% are enthusiastic about AI in their healthcare. I think that's something we need to work on and change. And I don't think that was a question about health, but I don't think that's just about health. And an informal poll of my peers, acquaintances, friends suggests that there is a little bit of ambivalence in our world about this technology and will it bring great or will it bring harm? Uh, so the first thing that I think that other industries can learn from healthcare has a very long history of engagement with consumers and communities. Not something we always get right, something we can get wrong in many ways, but the orientation in healthcare around trying to move at the speed of trust and create trust with patients and communities, I think is a little different than other industries I've worked in the past when you think about customer engagement and customer value chain. And I actually think around AI, it is a great area to learn from. So what can we do in all industries to make sure that we're building more consumer trust and more consumer enthusiasm for engaging with this kind of technology? The second I would think about in the spaces that I work in healthcare, we have a lot of conversations about labor and workforce right now. And I do not think that it's restricted to healthcare. We all sat and watched SAG Actor Guild this summer, and we're all watching the drama unfold with Scarlett Johansson and OpenAI like over the last days.
Yeah.
So these questions about how you can create tools I truly believe that in healthcare, the workforce question is asking the wrong question. I think these tools can supplement, support, and lift up the healthcare workforce rather than looking to replace a workforce. And I think that's something that industry can be thoughtful about. So we're looking for more productivity, we're looking for more joy, we're looking for a happier, more fulfilled workforce. And that might need some change, but I think we have to be thoughtful about how we're supporting our human beings, not supplanting them. And I think that's a universal, for me, it's like a universal truth. So those are the two that I'd go to thinking about engaging customers and engaging the workforce.
Yeah. One that I'm actually increasingly inspired by is cybersecurity. So that we can learn around how we protect our data, but also how we effectively not just protect our data, but also the appropriate application and utilization. Also, some of the work that is going on around AI safety, red teaming, that's so critical to healthcare and upholding the quality and standards of care and also the management of patient data. So I'm really excited to take a page from some of the cybersecurity learnings that I'm coming across. Zeki.
There are some comments and questions in the
Oh,
chat
good.
that mentioned it's even worse that haves don't even have to pay. Going back to the haves and have-nots, most vendors would be willing to work with them solely to get the brand. Would love to hear your thoughts on that. There was another one that said we should also think about the balance between efficiency and effectiveness and the human interaction component, especially around older adults who might be needing care and assurance or are vulnerable in some aspects. So those are some additional thoughts. Anything you all would like to say in response to that?
Yeah, I would say yes to both. Agreed. Yes. The point on who pays and how you pay, I just think it's just so important, not just in terms of buying technology or buying new applications, really all the way back to basics. You're talking about being able to afford the energy, right? Energy costs. And you're talking about, even if you have the same application, I can imagine a private academic medical center will be able to run on a stack that can run 25 million variables to do one diagnostic. And a health center will not have the technological stack to run maybe 3 million variables. So it's all these really basic ways that I think we have to think about how we're resourcing this to make sure that we don't create an even bigger inequity going forward. And on the human side, I totally agree. That was part of where I was going with thinking about how we're supplanting the workforce. There's never in my mind going to be, prove me wrong in 50 years, I don't know, but I feel like there's not ever going to be a replacement for what your care provider does for you. They look you in the eyes and they have a conversation with you and they help you understand things. Look, I've been a patient, I've been a cancer patient, many moments that I've been very scared. There's no replacement for that human touch of someone to hold you in those moments. But I can say that what happens when a physician's done talking to you, they turn around and they go to UpToDate or they go to Google and they try to figure out what's going on. And there are definitely ways that AI can make that process more seamless for them, less painful, and honestly less jarring for the patient.
Yeah, no, Cara, I think what you're underscoring there is that I think again, if we keep this problem focused, it's going to create the opportunity for some of the productivity and throughput things that can gum up healthcare have a smaller piece of brain capacity and management that it gets back to that physician-patient interaction. And again, I think that connection, like we're never going to move away from desiring that connection. So labor markets are going to shift. I have a hypothesis around carrying industries, whether that's healthcare, education, carrying industries will be disrupted, but we're always going to want that human connection. And so that I think is the promise of AI is it's man plus machine, not man versus.
That comes to the end of our fireside chat. Thank you, Kara. Thank you, Annika, both for kicking us off with a great, lively conversation. And I really appreciate you all framing the following conversation. You touched on so many issues in just that short amount of time.
That concludes this conversation.